If you have a child between 0 to 6 years old, this video is going to change how you think about your teeth. Not because what you are doing is wrong, but because there is so much that the parents are simply never told. Hello, I am Dr. Nandlal. I am a pediatric dentist based out of Mysore, and I have been providing oral health care for children for many years. In the next 10 minutes, I am going to walk you through everything that parents need to know regarding oral health. When to see a dentist for the first time, what is actually happening to your child's mouth at every age, how to spot a cavity before it needs a drill, the brushing mistakes most parents make every day, when brushing actually causes more damage than good, 5 myths that are quietly harming your child's teeth, and what thumb sucking is really doing to their jaw. By the end of this video, you will know more about the toddler's dental health than most parents ever will. Let's start. The most common question I get from the parents is, when should I take my child to the dentist for the first time? And the most common answer I hear is, when something starts to hurt. But by the time something hurts, the damage is already done. Here is a rule. The moment your child's first tooth appears, that tooth can get a cavity. That tooth needs a dentist. Ideally, your child should see a dentist by the time they are 1 year old. Not when the tooth breaks, not when they cry at night, and if your child is already 2, 3, 4 or 5, it is still not too late. Start now. Now the question parents never ask but always want to know, what actually happens on the first visit? The first visit is not about drilling, it is not about the pain, it's a short, gentle examination. The dentist checks how many teeth have come in, look on every signs of the decay, checks the bite and the jaw development, and the checks how your child is breathing through the nose or the mouth. The appointment is usually over in 15 minutes. Your child sits in the chair, often on your lap, for the first time. Dentist uses a small mirror and a gentle probe, that's it. But here is what the child visit really does. It makes the dentist a safe and a familiar place before there is ever a reason to be scared. Whether your child loves their dentist or fears them is entirely in the hands of the parent. Timely visits leads to prevention, delayed visits leads to restoration. Next, let us talk about the fear children have about dentists. This is totally avoidable. Let me tell you the 3 things parents say which creates dental anxiety. Number 1, don't worry, it won't hurt. The moment you say this, your child knows something might hurt. Instead say the dentist is going to count your teeth and check they are all growing well, factual, calm, and no mention of pain. Number 2, be brave. Brave means something scary is coming. Instead, say, the dentist is really good at their job, you are going to be absolutely fine. Number 3, using the dentist as a threat. If you don't brush your teeth, you will have to go to the dentist. This turns the dentist into a monster, and that fears can last for a lifetime. The dentist is not a threat, dentist is your child's partner in keeping the smile healthy. Treat it that way from the very beginning. Next, let me tell you about the dental milestones and how you can support good oral health. 0 to 6 months, no teeth at, but bacteria are already present on the gums. Wipe your baby's gums with a clean damp cloth after every feed. 6 to 12 months, the lowest front teeth appear first. This tooth can get cavity the day it erupts. Start brushing immediately. Use a rice grain size amount of the fluoride toothpaste and book that first dental visit. 12 to 18 months, upper front teeth come in. Your child now has up to 8 teeth. Watch for the chalky white spots on any tooth. That is the earliest sign of the cavity forming. 18 to 24 months, the first molars arrive. These are the hardest teeth to clean, so pay extra attention to the back of the mouth. 2 to 3 years, your child now has all 20 milk teeth. This is when the cavities become most common. Start dental visits every 6 months from this point. 3 to 4 years, gaps between the milk teeth are normal and healthy. They are making room for the permanent teeth. But if you notice crowding or overlapping teeth, see your periodontist. 4 to 5 years, milk teeth start loosening. Do not force them out, let them fall naturally. Milk teeth holds a space for the permanent teeth, keep them healthy. 5 to 6 years, the first permanent molar arrives behind the milk teeth at the back. The tooth does not get replaced, ever. Ask your dentist about fissure sealants to protect those deep grooves. Next, let us talk about the cavities. They are like termites. By the time you notice, the damage is already deep unless you check carefully and regularly. The earlier sign is chalky off-white spot on the tooth. Note the white spot on the clean tooth, but a dull chalky patch on the surface. This is the stage 1. Barely visible, easily missed, but this is where it can still be reversed. If you ignore it, the enamel starts to break down and you will see a brown discoloration. And this is stage 2. It needs treatment now. Ignore it further and you have a visible cavity, that is stage 3, and your child would probably need a drill. So the white spot is the window. Miss it and that window closes. So white spot is your window, miss it and that window closes. Tonight, after you brush your teeth, take a torch, open the mouth wide, look at every tooth, front, back, along the gum line. If you see anything that doesn't look right, book an appointment. Don't wait for the brown, don't wait for the hole, don't wait for the pain. Next, let's talk about the common brushing mistakes. These are easily avoidable. The mistake 1, a wrong toothbrush and the toothpaste. Your child's toothbrush needs a small head and soft bristles. An adult brush is too big and it misses the corners and it hurts. For the children under 3 years, a rice grain size amount of fluoride toothpaste is recommended. For 3 and above, a pea size amount, no more. About fluoride, is it safe? Yes. It right amounts, it is not only safe, it is essential. The fluoride strengthens enamel and helps repair on the early stage damage before it becomes a cavity. So the key is correct amount, not more, not less. Mistake 2. Wrong technique. Brushing hard and fast feels thorough. No, it is not. It damages the gums and messes the plaque along the gum line. The right technique is small, gentle, circular motions. Angle the brush towards the gum. Cover every surface, front, back, and the chewing surface. Mistake 3. Not long enough. 2 minutes. That is how every brush should take. Most parents stop at 30 seconds, so use a timer if needed. Make it a game, but hit 2 minutes every single time. And one most important thing most parents skip entirely is flossing. Brushing only cleans 60% of your child's teeth, and the other 40% the toothbrush never reaches. So flossing should start as soon as the 2 teeth touch, typically around the age of 2 to 3 years. You do it for them until they are 8 and 10, once a day at bedtime. Next is something that needs a reframing. Did you know that there are times when brushing your child's teeth causes more damage than not brushing at all? Let me list the scenarios. 1. After juice, fruit or anything acidic, acid temporarily softens the enamel. Brushing immediately after scrubs that soften enamel away. Let the saliva neutralize the acid first, then brush within 30 minutes. 2. After vomiting. Vomiting is highly acidic. The instinct is to brush immediately. Don't. Rinse with water, then brush within 30 minutes. 3. After breakfast. Most parents brush after breakfast, but the most important brush of the day is before breakfast, not after. Overnight, the bacteria built up in the mouth. Brushing before breakfast removes the bacteria before your child eats. Let me summarize. Brush before breakfast. Wait a bit after anything acidic. Always brush at bedtime. Brushing at the night time is as important as brushing at all. Next, I am going to bust 5 common myths. This is really important. Myth 1. Baby teeth don't matter because they anyway fall out. Wrong. Milk teeth hold space for the permanent teeth. A cavity in a milk tooth causes a pain, infection and damages the permanent tooth underneath. Treat milk teeth like permanent teeth. Myth 2. More toothpaste means cleaner teeth. Again wrong. More toothpaste means your child swallows excess fluoride, which causes fluorosis. Rice grain for under 3, pea size for 3 and above. More is not better. Myth 3. Fruit juice is healthy for toddlers' teeth. Totally wrong. Even 100% natural juice coats every tooth with sugar with every sip. Make water as a default drink for quenching thirst. Myth 4. Brushing harder means cleaner teeth. Hard brushing damages gums and strips enamel. Small, gentle circular motions. Let the bristles do the work, not the pressure. Myth 5. You only need a dentist when something hurts. By the time it hurts, the damage is already deep, and the first visit by age 1 is recommended, and every 6 months after that. Prevention costs far less than restoration in money, time and pain. Next, let us talk about something that parents often have doubts about: thumb sucking and pacifiers. They are quite normal in babies and in young toddlers up to the age of 2. It is not the dental concern, but beyond the age of 3, the pressure of the thumb sucking pushes the front teeth forward, it narrows the palate, and it affects how the jaw develops in same way the mouth breathing does. If your child is still sucking the thumb and using a pacifier beyond the age of 3, mention it to your dentist. Early intervention is simple, ignoring it is not. The same applies to the pacifiers. Never dip them in honey or sugar, the habit that is still surprisingly common, directly causing early childhood cavities. Now, let me summarize everything I said. First, visit by age 1. Look for the white spots before it becomes a hole. Brush correctly for longer enough at the right times. Floss from age 2 to 3. Don't believe the myths. Watch the thumb sucking after the age of 3. Whether your child loves their dentist or fears them is entirely in the hands of the parents. Timely visits to the prevention, delayed visits leads to restoration. Part 2 of this guide covers the science behind why cavities really form, saliva, diet, gut health, mouth breathing, and 10 factors that determine your child's true cavity risk. Link is in this description. If this video helped you, share it with every toddler parent you know and subscribe so you don't miss the part 2. See you there.